Medicare is turning 58, so we're in Washington, D.C. with the New York City Retirees. I'm Mark Harris, and all that and more as Labor This Week begins now.
Well, we're taking New York City retirees and we're going to Washington, D.C. today. There's two reasons. One, we're going because it is Medicare's birthday on the 30th, so we're going to make sure that we can urge Congress to protect Medicare and bring back Medicare the way it was intended to be for the American people. And two, also to highlight the issues that people are having with Medicare Advantage plans and when they're forced into them or auto-enrolled like the city of New York, the mayor is trying to do to us, and damaging prior authorizations with delay and deny care, narrowed networks. Those are the things that we're trying to highlight today.
We've seen a lot of you guys.
On our way to Washington to talk to our representatives about taking away our traditional Medicare and putting us into a Medicare Advantage program.
Forcing us into a Medicaid Advantage program, which has the right to deny you or minimize the treatments that you get. I worked my entire career, sacrificed salary so that I would have a health plan, and now they don't want to give me what I sacrificed for. Exactly at the time when I might need it the most.
Right.
So that's why I'm going to Washington. I think unions are a great idea. Occasionally they get it wrong, and this is one time they got it very wrong, and we want them to know that, and we're willing to fight for them to do something about it.
They went to D.C., they saw their representatives, and while they didn't conquer, they did set a tone for the beginning of a national conversation.
Well, look, I think that this is one of the most successful programs we've ever had in the country. It is a program that was designed to give seniors the care they need when they need it, and it is run incredibly effectively. However, we have let private insurance companies into loopholes with Medicare Advantage, and they are now trying to privatize Medicare, take away Medicare, and ultimately deny people the care they need. They also are defrauding people. Even the name, frankly, Medicare Advantage, is a real problem because seniors think that that's Medicare, traditional Medicare. They get pulled in, they get fooled, and then they can't get back out. And they still don't get the care they need, and they're dying. So this birthday is a moment to appreciate how successful Medicare has been and to continue to ensure that nobody privatizes it and ultimately that we expand Medicare and we have Medicare for all.
Is this going to be a big issue in the 2024 election?
I think healthcare is going to be a big issue. And look, we, Democrats have done a lot to keep prices down, but I am concerned that the way we've done it has been to subsidize private insurance companies. And what we need is to expand Medicare. Medicare is a program that people trust. It's why these private insurance companies call this Medicare Advantage, because they know that that's a good thing in people's minds. And we need to stop that, and we need to close all these loopholes, eliminate Medicare Advantage, use the savings that we get from that to expand Medicare so that it can provide the things that it needs to provide. Because some seniors will tell me, well, Medicare's not enough, I need something else, and I have a lot of empathy for that. We don't cover dental, vision, and hearing in Medicare, which is crazy. There are other things. We have co-pays, deductibles, things that seniors have to pay. And so what Medicare Advantage and these private insurance companies do is they use that to pull people in and say, we're going to give you all these other things, and then of course make it impossible for people to get back out and get back onto traditional Medicare. In either situation, they still need those benefits. And so we should expand Medicare to include all of those benefits, and we should expand Medicare so everyone has the opportunity to have a government-funded insurance system and get the care they need where they need it.
Are you co-sponsoring any bills? Would you be willing to introduce any bills about Medicare Advantage?
Oh, I already am co-sponsoring many. I led the letter about Medicare Advantage. As the chair of the Progressive Caucus, we had a very excellent discussion where we brought panelists in to educate our members on Medicare Advantage. A lot of people didn't know. In the past, the industry has managed to put out a letter that has a lot of Democrats signing it in support of Medicare Advantage. We were able to really change all of that this year. They were not able to get the signatures on that letter, and they understand that we are, this movement of activists and members of Congress is finally starting to turn the tide on helping people to understand that we will no longer allow these private insurance companies to deny care and cause the deaths of people across this country.
And you represent the folks from Seattle, Washington. We're down here with a group from New York. Do you see this as a national issue? Do you see it rapidly expanding as a national issue?
It is a national issue. Healthcare is a national issue. The insurance companies and the way that they've targeted and used their greed to deny people care is a national issue. So yes, I think we have people across the country. I don't know if only people from New York are here, but if that's the case, I can promise you there's a group like this in states across the country, and it will continue to be a growing national movement.
The Rally to Save Medicare was organized by Be a Hero, which is a nonprofit organization that promotes healthcare as a basic human right. I had a chance to catch up with the group's co-executive director, who gives us her views on the current Medicare situation.
Started looking around the country to be like, who else is as concerned about this as we are? And we found these guys in New York and other groups of retirees in other states elsewhere. Oregon has a group of retirees working on this. And so we've been really inspired by what they're doing. And it's, to me, like nothing's going to change unless people demand it to change, and it means that we need to be organizing people and to really see that they've been successful in organizing retirees to begin to fight back against this gives us hope that we can do this on a larger scale. And so we're just really great to be happy to be here today with them, and I'm sure that this will be the first of many DC trips together. Marianne and I were just talking, and we're going like, we'll be back in a few months. We'll be here until the fight is won, because this is actually one that's incredibly critical. I've worked on healthcare now for my entire career, so for about almost 20 years now, and I think this is the biggest threat to the future of healthcare in this country for a number of reasons, and so it's why I'm showing up as someone who is not close to Medicare age, but who has, in-laws and people that I love who are on Medicare and who need to be able to get the care that they deserve, and who wishes that someday Medicare will be there for me too when I need it.
There's 250,000 people we're talking about in New York City. How many do you estimate there are across the country that are going to be in the same position?
I don't know how many of public retirees. I think each city is starting to make these decisions, but the incentives are incredibly skewed. Cities have every incentive to put people on these plans because the federal government is subsidizing these in a huge way, much more than they are traditional Medicare. And so on the surface, for them, it's cheaper. I mean, the argument you hear from the New York City government is they're going to save hundreds of millions of dollars a year or something. I think what they've been saying, 600 million a year. And so that has been set up by the federal government to be that way, to subsidize Medicare Advantage at the expense of traditional Medicare and patients on traditional Medicare. And it's why we're showing up to demand that shift. We shouldn't be subsidizing private health insurers who then turn around and don't actually provide the care that they're supposed to patients, but instead line their pockets and the pockets of their shareholders as their number one priority. That is not something that taxpayers should be doing with our money.
Would you say that this is the beginning of the privatization of Medicare? Is this what's really driving this?
I would say this has been happening for 20 years. That's the hard thing about this. Many of us who worked in healthcare, it was happening quietly. And they were sort of creeping up on their market share quietly in the background, and with a big acceleration in the last 10 years. And so really, while we were fighting other fights, fighting for the Affordable Care Act, fighting to save the Affordable Care Act, this was all unfolding. And so I would say the privatization of Medicare has started already. This year, Medicare Advantage will account now for 51% of all people on Medicare. By all looks of it, they've privatized the thing, right? We need to fight back. We can't let it get much more than that. They already have the majority of the market share, and what we need to begin to do is to beat that back. So we are sadly in a defensive fight, and we understand that, but it is one where I think my assessment at least is the insurers have overplayed their hands. They are scamming the government. They're doing illegal things left, right, and center to get more money out of the government. That estimated $75 billion a year is in illegal scams that they're running to make patients look sicker than they are and take money out of the government. And I think this continued denial of people not giving people actual care, people are angry about that. And what we see is that people want to fight back. And we believe that for every dollar that every $10 that they are gaining from this, we can bring people power to fight and to match that and to win eventually.
Yeah, and it's a subject, would you say it's a subject that crosses both sides of the aisle? It's important to everyone.
Yeah, it's really interesting. Republicans have been talking about the deficits, wanting to rein in spending. Well, here's $75 billion a year that's going out the door because someone's ripping you off. And when you care about the deficit. So Republicans care about this because they're like, why are we wasting taxpayers' dollars, right? And Democrats care about this as well. The other reason they care about it is because people across the aisle have learned that they have to care about healthcare. If they want to get elected, if they want to keep their constituents with them, one of the number one concerns of most Americans is healthcare. How they're going to afford it. Will it be there for them when they need it? And so many, many people care about this issue, and what we're finding is that there's actually support across the aisle for this.
We were so impressed with this woman's personal story that we asked her to share what inspired her. Listen to this. You're such an inspiring woman, and you're so accomplished and so educated, Rhodes Scholar. Can I just ask you what drives you?
Yeah, when I was 21, I was a sort of new immigrant to this country. I just finished college. I didn't have health insurance. This is in the days before the Affordable Care Act. And I became really seriously ill. I was really suddenly paralyzed from the waist down. And I spent 8 months in hospital, learning to walk again, and with no insurance. And I was in debt, over $1 million in healthcare debt. I got really lucky. I had people fight for me, and I had a hospital CEO give me charity care and wipe it away. But I was so angry because I knew it shouldn't be that way, right? That's not how healthcare should function, right? We shouldn't have to depend on the charity of strangers to get the healthcare we need, not in the richest country in the world. And so that is what drives me in this fight. It is deeply personal.
Unfortunately, our cameras were blocked from attending any congressional meetings. I don't know why that should surprise me. That's always the case when lobbyists and government officials talk. However, most of the retirees we talked to found the trip well worth the effort and are in the fight for the long haul. And in a conversation with Marianne Pizzatola just before coming on air, she told me she was generally happy with the conversations the different groups had with the 19 representatives they had a chance to speak with. At the end of the long day, the group attended a rally on the steps of the U.S. Capitol, hearing from the likes of Senator Elizabeth Warren and others who voiced their support for keeping Medicare from being privatized. I'll be right back. This was a terrific beginning for what could be a long fight. In Washington, things change when people come together. The key word there is together. When we sit in a doctor's office waiting room with other patients, our political affiliation doesn't matter. The color of our skin doesn't matter. Our former union affiliation doesn't matter. What does matter is that we all want the best outcome from our doctors, insurance providers, and our healthcare system. Save the politics for an evening beer together. Allow your differences to be heard. Listen. Agree and disagree, and agree to disagree. But most importantly, see that this issue isn't about you versus them. This issue is quite literally a matter of life versus death. We are all going to need all the help we can get, so why not get it from each other? Why not come at politicians in Washington and even in New York City in numbers so large that they have no choice but to cross the aisle and agree on a solution to Medicare that serves all of us? It is possible. Follow your leaders with one voice, and and you will win this fight. I'm Mark Harrison, and I'll see you next week on Labor This Week.